Welcome everyone, and thank you for joining us for our webinar, VO2 Max Test Optimization for Cardiometabolic Phenotyping in Rodents. This is Haley Carleton, and I am very pleased to be moderating today's webinar. We will be joined by Jennifer Petrosino, a PhD candidate in the Biomedical Sciences program at Ohio State University and National Institute of Arthritis and Musculoskeletal and Skin Disease F31 Fellow. She will discuss her research in the mechanisms that regulate muscle growth and repair and aim to empower researchers with a stable base by pointing out key instrumentation features, an easy-to-follow protocol, and equations for cardiometabolic phenotyping. And with that, Chris, take it away whenever you're ready.
Thanks, Haley. Hello, everyone who's joined us. I greatly appreciate your time today and look forward to the conversations most of us will have very soon. I hope today's presentation will have something for everyone, for new researchers, a better fundamental understanding, a base to build from, and a peek behind the engineering curtain for those experienced researchers who want to optimize their configurations or solve old puzzles. So we'll start at the beginning. Why are we doing all this? Coronary heart disease has been the #1 killer of people for almost 2 decades. Its partner stroke in the top 5 and their henchman diabetes is consistently in the top 10 worldwide, and all three are elegantly intertwined. It's a very complicated puzzle. Many tests and screens exist, but the gold standard where the rubber meets the road is the graded exercise test. Everyone has seen the Gatorade commercials with the athletes on treadmills wearing respiration masks with the big hose attached. And the workload is gradually increased by ramping speed and running angle to push the person towards maximum physical exertion, all the while measuring VO2, which is simple but not easy. Just ask the person running. Indirect calorimetry is more commonly employed for metabolic phenotyping and measuring energy expenditure and energy balance in combination with other behavioral parameters. And most people watching this probably have some level of exposure to how those systems work, and it makes a convenient reference to illustrate just how much more we're asking from a calorimeter with this application. The largest difference, of course, is the experiment time. Metabolic phenotyping takes 3 days minimum, which affords a lot of time for sampling and measuring. Most systems space those samples out by several minutes per subject, where the VO2 Max test is around 20 minutes total. Large gaps between samples will not provide the data density needed to perform the test correctly or gather any meaningful results. Samples must now be seconds apart, not minutes. Another big difference between metabolic phenotyping and cardiometabolic phenotyping is that it requires active participation from the researcher. With metabolic phenotyping, once the animals are loaded in the cages, the test has begun, you wipe your hands of it, and you come back 3 days later and you collect your data. With VO2 Max, the user has to judge the subject's performance in real time and increase the workload accordingly to guide them through key checkpoints in the test. Lastly, pushing a subject towards maximum exertion naturally results in very rapid metabolic changes and in VO2 consumption. For metabolic phenotyping tests, energy out versus energy in can be done while sampling animals at a comparatively leisurely pace. Spikes in energy expenditure are more of a curiosity, but rarely the focus of such tests. But VO2 Max is only about measuring rapid metabolic changes, but more importantly, doing so on command. Adapting the GXT test to mice isn't without its obstacles. Good luck getting a mask on a mouse. And human subjects can be motivated with words, but unless you're Dr. Doolittle, you won't be able to coach your mice along. It would be likely to have the opposite effect on the mice. So we have to make some compromises. For motivation, we use an electric stimulus. And this might be a bit barbaric, but in this application, the alternatives aren't really feasible. For air puff, where's the air for the puff going to come from? It'd have to come from a tank, like outside the chamber. And when it goes off, it's just a giant air leak, and your metabolic signal gets puffed away like magic. And then the sharp stick method, probably being the most humane option, would require breaking the airtight seal to poke at the animals, which introduces an air leak. It's not as devastating as the air puff, but this is important. There can be no air leaks in the chamber. For a mask, we're just going to make a really big mask. so big that we can fit the whole mouse and a treadmill inside of it, which of course sounds a little absurd, but it's what we've done. The problem we've created for ourselves, though, is that the mask has a very small volume and the enclosed treadmill does not. Each breath from the mouth takes and makes up a larger portion of the mask volume than it does the treadmill volume. So how does this impact our test? The dark shadow of uncertainty is the time constant. More important than what it is, it's what its effect is on the measurements. And here the motorcycle represents the time constant, and the series of dramatic hills in green at the bottom is our true metabolic signal. The observer doesn't see this. They see this much mellower blue line as the motorbike damps the true intensity of the track. The dips aren't as low, but more importantly, the highs aren't as high, which is not good when measuring the max of anything. The easiest thing to do is, mathematically, the time constant is simply the volume of the cage divided by the flow of air through it. Large time constant, large damping effect. Small time constant, small damping effect. And the smaller the damping, the closer our measured signal is to the true signal. So what can we do to improve this? The easiest thing to do is to minimize the enclosure volume, but since we have to fit the whole mouse and a treadmill inside, there's only so much dead volume we can eliminate. And we can increase the airflow, and turning it up to the max might seem like the simple answer, but the airflow not only impacts the time constant, but it also impacts the signal strength. So the principles of indirect calorimetry are such that having a measurable difference of oxygen and CO2 in versus out of the cage is the whole way it works. As the time constant shrinks, so does the signal. And so the flow has a speed limit that's dictated by how small of a respiration differential the calorimeter can measure. And this is where most folks have to choose between performance and price. The fastest and most sensitive systems are also the most expensive. Further complicating things is the paradox between what makes for good calorimetry measurements versus what makes a good treadmill. Lots of room to run with lots of fresh air makes a great treadmill, but it's terrible for calorimetry measurements. Low volume and high differentials make for very certain gas readings, but results in a treadmill that's too cramped and stuffy to run in. Optimizing a system design means finding the best balance point so all things can function in concert. So in summary, the key ingredients needed to perform this test are a treadmill that's easy to work with. You have to be able to easily adjust the speed and the angle, and it has to have sufficient room for the animal to run, but not too much room. And because you'll want a time constant of about 90 seconds or better, and of course with a better time constant comes the greater need for higher resolution gas sensors that can also measure RAR in real time. Those are the key ingredients to measuring VO2 max on a treadmill.
Jen, the floor is yours whenever you're ready.
So exercise testing is the gold standard for measuring cardiopulmonary and metabolic fitness. And that's because through the years, we've really come to understand there's this relationship between fitness and mortality, where if you have a low fitness level, your mortality rate is high. And if your fitness level is high, your mortality rate is low. And so that's because fitness is directly impacted by the respiratory, cardiovascular, and musculoskeletal systems. And so because of this reason, over the years, people have really adopted using exercise testing as a measurement for cardiopulmonary fitness. And so what exactly is cardiorespiratory cardiometabolic fitness? And that's the ability to perform dynamic exercise involving all of your muscle groups at a high intensity for a prolonged period of time. And the way that we measure this, the way that we do these exercise tests is by usually using a VO2 Max test, where we're measuring gas exchanges during a graded maximal exercise test. And so when we actually ask this question of what is VO2 max, it's the rate of maximal oxygen uptake during exercise. And it can be calculated with an equation, which is your max heart rate times your max stroke volume times your AVO2 difference. And so basically, when you look at this measurement of VO2 max, it really becomes a multifaceted number that's affected by the maximal heart rate, the ability of your heart to pump blood, and kind of the gas exchange that's going on in your body while you're exercising. And when we look at VO2 max, and some others will call it actually a peak if you don't see a plateau. We're thinking of it that plateau in maximal oxygen consumption as workload continues to increase during an exercise test. And so what are the things that impact VO2 max? VO2 max is impacted by three systems: your pulmonary system, your cardiovascular system, and your muscular system predominantly. And so when we look into that first part of that equation that makes up VO2 max, what we look at is really cardiac output, which is heart rate times stroke volume. And so cardiac output is one of the largest contributors to impacting your VO2 max. So if you have a low cardiac output, you're going to have a lower VO2 max. Also affecting your VO2 max is your muscle blood flow and capillary density. So like if you think of the endurance runner, they have a high capillary density in their muscle. They normally have higher VO2 maxes. Also, other impactors of VO2 max are things like hemoglobin content, muscle mass. Muscle mass is a huge impactor of VO2 max. So people who have lower levels of muscle mass have reduced VO2 maxes. Also, your muscle fiber types, your muscle oxygen extraction, and your pulmonary function. And so these are all contributors that go into what would affect a VO2 max. And so what is VO2 max testing? VO2 max testing, especially what we look at in the clinic with the gold standard, is normally we break down to the Bruce protocol or a modified version of it. And the Bruce protocol was developed in the 1950s by Robert A. Bruce. And this is really our gold standard. It's an 8 to 12 minute test where you have graded increases in inclination and speed. And so by using these graded maximal exercise tests and determining VO2 max, we can then make determinations about the cardiovascular, pulmonary, muscular, aerobic fitness of an individual. And so what are the components of a classical graded maximal exercise test? And if we look at the American College of Sports Medicine's considerations of what goes into these tests have incremental increases in workload. There are uniform increases in physiological. There are the ability to make accurate estimates of exercise capacity and ventilatory threshold. And then there's a targeted duration of 8 to 12 minutes. And that's because the relationship between VO2 max and workload is best captured in that time frame. Under 8 minutes, that relationship loses its effectiveness, and at a test that lasts over than 12 minutes, they're severely impacted by things like muscle fatigue, and the test loses the strong relationship between VO2 max, workload, and then subsequent predictions about mortality rates and fitness. And so if we're in the clinic, we're using exercise tests as a way to determine fitness levels in individuals and subsequently health and mortality rates. Why would we want to use exercise testing in mice? And that's a pretty easy question to answer. The first is that it allows for a functional metric of cardiometabolic and cardiovascular fitness and function. So currently, many of the methods in vivo in mice to test their fitness and function, or cardiac function specifically, require anesthetizing the mice. And so when we're using an exercise test, we no longer have to anesthetize them. So we can get kind of this more accurate prediction of non-anesthetized function. And that's important because exercise capacity is considered a surrogate measure for cardiac function during exercise. And so that really allows us to be in a position where we're kind of mimicking a clinical and physiological situation because the mice are not anesthetized. And since in the clinic, this is a gold standard testing protocol, you could say for the mice in their clinic, this can be their gold standard. We can also use these tests using the indirect telemetry measurements of gas exchange to determine impairments in fuel substrate utilization during testing, since in an exercise test, the animal goes from aerobic to anaerobic levels of metabolism. And I know that all our researchers like to hear this, but exercise testing is cost effective, it's repeatable, it requires not sacrificing your mice, and it can be followed longitudinally with no anesthesia. So it's an overall win in many categories. And so when we look at the tests that we have developed in mice for performing graded maximal exercise testing compared to humans, you'll find that they're very much a kind of copy of one another. Both tests last for 8 to 12 minutes if we're talking about a Bruce protocol test compared to a mouse Bruce protocol. Both tests involve concurrent increases in speed and inclination. Both have a confirmed maximal exertion, and both have a significant increase in post-test lactate concentrations, which is an important indicator of switching from aerobic to anaerobic metabolism and really performing maximal workload. And if we break it down even further to kind of look at these endpoints in human and mouse testing, we can see that there's a lot of things that are conserved, which is great if you're working in a mouse model and wanting to make kind of translatable findings. In a graded maximal exercise test, whether it be in a human or in a mouse, we're looking for a respiratory exchange ratio of greater than or equal to 1. We're looking for plateaus in maximal oxygen uptake, and that way we can determine the VO2 max or VO2 peak. So we're looking for that O2, VO2 level to kind of level out as the workload increases. We're looking for a significant increase in post-lactate levels. And so although if you're doing a test in your mouse, you don't need to measure this every time since these mouse protocols have been validated and published, we do have the confidence of knowing that just like in the human tests, in the mouse tests, we're getting this nice spike and increase. And also, we're having maximal exertion, whether it be a reported RPE from a human on the RPE or Borg scale, and then with the mice, continuous contact with a shock grid for greater than 5 seconds. Not as friendly as how do you feel, but still effective. And so I think it's important to not see that just the tests are similar, but to also kind of understand how human and mouse physiology is similar. Obviously, there's quite a large size difference in mice and humans, but despite the size difference, they both have shared responses to maximal exercise testing. Both undergo increases in oxygen consumption, carbon dioxide respiration. We have increases in that ratio VO2 to VCO2, which is known as respiratory exchange ratio or RER. There's an elicited increase in heart rate. However, it is important to note that heart rate, VCO2, VO2 are slightly higher in mice compared to humans. And where the two differ is that in humans, there's a linear increase in blood pressure with the increasing workload, and with mice, the blood pressure plateaus as there's an increasing workload. And some other small minor differences between the mouse and the human during exercise testing are really just driven from the fact that the mouse heart is tiny. We're looking at a 200 milligram heart, whereas in a human, it's 250 to 300 grams. The average heart rate of a human is much slower, 60 to 90 beats per minute, whereas in the mouse, you're looking at 400 to 600. And then just additionally, it's important to note that the cardiac output for mice is 2 to 9 times higher than it is for humans, again, related to heart rate and some other factors. But despite these differences, it's still nice to know that they have so many shared responses in maximal exercise testing, which means it's a really good tool to kind of see if your mouse model is phenocopying some of the defects observed in a healthy individual versus, someone with some certain disease that your mouse is trying to phenocopy. So we know that with humans, VO2 max is impaired in conditions such as aging or diet-induced obesity. And so the question is, do we see the same trend in animals? We can start by just simply looking at data from animals and seeing that indeed in conditions of aging or diet-induced obesity from either a Western diet or a high-fat diet, that VO2 max is also impaired here. And so although there's not a star, you can see that it is significantly reduced in both aged mice, 2 years of age, Western diet or high-fat diet-induced obese mice. And so it's really nice to know that when you look at the mouse data, it's phenocopying what you see in the humans, which is that these pathologic conditions are inducing reductions in VO2 max using graded maximal exercise testing in mice. Since we know we have a test that somewhat shows what we would see in the humans who have different types of issues, how would we actually go about performing this test if you're a researcher who is looking for something where you can continuously test your mice, follow them longitudinally, or just phenotype an animal? Well, we're going to break it down right here. If you're performing a graded maximal exercise test in mice, you're going to have, after a warm-up period, a series of stages. In stage 1, for 2 minutes, the mice are going to run 9 meters per minute at a 5% incline. After that first stage, you'll move up a second stage where the incline increases again, and you move at 3 meters per minute faster, so 12 meters per minute. These increases in inclination occur again for another 2-minute stage, moving 3 meters per minute faster at 15. And then by the time you hit stage 4, no longer is inclination increasing, but we're continuing to make minute-long increases in speed, 18, 21, 23. At stage 7, finally, we move to a increment by 1 meter per minute increase in speed. And so normally mice are only going about 8 to 12 minutes into this test, so these don't go on for much longer. If your question is why is the inclination not greater than 15, why are we not looking at 20 and 25% inclination? These inclinations become extremely severe, and so it gets to a point where you can't pull out finite differences because the locomotion of the mouse is impaired by this excessively steep incline for a type of testing where we just want progressive increases in VO2 max and workload over time. When this mouse has been running a test and it's coming to the endpoint, as briefly mentioned before, what are we looking for? We find that the respiratory exchange ratio becomes greater than 1, that the maximal oxygen consumption, the O2 uptake, is going to plateau or peak even though workload is increasing. Lactate levels are going to be significantly increased, and they'll be in contact with the shock grid for equal to 5 seconds or greater. And that indicates that your test is done. While we're running these tests and we have these endpoints, what's actually going on in this chamber that Chris talked about that these mice are running in? And so in these chambers where these mice have this treadmill, these enclosed chambers, there's a variety of factors that are coming in and then factors that are coming out. So coming in, we measure the nitrogen in, the oxygen in, the carbon dioxide in, and then we measure the values going out. So the nitrogen out, the oxygen out, and the carbon dioxide traveling out. And that's important because from that information, we can actually calculate the volume of oxygen and the volume of carbon dioxide. The formula is written here for your convenience. By calculating those values, we can then calculate what later becomes a very important value for some of our subsequent type of phenotyping analysis, which is respiratory exchange ratio. And that's really just an equation where you're looking at the amount of VCO2 over the amount of VO2. And it's important to note that respiratory exchange ratio is really kind of just a measurement that's going to be used to determine fuel substrate utilization. Are these animals using predominantly fat at the stage versus carbohydrates? And I'll get into that a little bit more later. But so from those measurements that the machine is directly calculating, like we've mentioned, we can calculate some other subsequent things, whether it's respiratory exchange ratio, and I just spoke about that. But then from RAR, we can calculate something further, fuel substrate utilization. And we're going to do that using an equation developed a long time ago by Dr. Lusk. And so this is a very well-established equation where to determine the number of carbohydrate grams per minute, the formula is written right there, or fat grams per minute. And that's great because then we could go ahead and plot those things out and say, okay, well, perhaps there's an issue in this animal in fuel substrate utilization, which would be indicative of when coupled looking at, let's say, anaerobic threshold, an issue, and kind of just even crossing over into anaerobic metabolism. And so as you can see, these things build on one another. By calculating RAR, we can figure out fuel substrate utilization. By plotting RAR, we can also figure out anaerobic threshold, the point at which there's an abrupt increase in respiratory exchange ratio and indicative of a shift into anaerobic metabolism. And then these crossover points from fat oxidation into carbohydrate oxidation. And that's just because by nature of any graded maximal exercise test, something that starts aerobic becomes anaerobic over time. And then finally, we can calculate a couple of other measurements, such as the caloric value of a test, as well as the amount of heat generated from a test. And those will allow for calculations of calories burned if that's information that's important to you as well, or metabolic equivalents. So what do we expect to see when we look at these values during testing? Because it's a lot of things that are being thrown around, and if you're not familiar with exercise testing or the response to exercise, these things can be rather confusing. Well, we already know that we're having a test where with each stage, workload is increasing. So the speed is increasing, the inclination is increasing. And so as that occurs, the heart rate and the oxygen usage by the mouse is going to go up. And so you can see on this scale where we're looking at the bottom going across, if it's 40% of the VO2 max to 100%, as that occurs, we're looking over here at the amount of O2 usage increasing, and fuel substrate use is also going to increase over the testing time, where at the beginning of the test, predominantly fat is used for fuel, and that's an RER of 0.7, and then by the time you hit an RER of 1, it's indicative of 100% carbohydrate oxidation. And so if you kind of look at this graphically depicted chart and this mouse that's running, you'll see that when we look at the actual RER values, they'll be slowly increasing as the test goes, and then at a certain point, there's going to be an exponential increase. With VO2, the test is going to experience kind of this gradual increase for quite a long time until a maximum value is achieved, and it's going to plateau off despite increasing workloads. And then you'll have a steady increase throughout in a normal test of things like speed and heart rate, but we don't normally measure those due to some complications with just kind of all of the values that are being taken in at once. That's a nice cartoon schematic, but so what does it look like in real time with actual data? Right over here, just for convenience, so you can really truly understand how similar some of these data look to human testing, we have plotted a single wild-type C57 mouse performing a graded maximal exercise test compared to a human test. And so the thick line on the top, if we're looking at the mouse graph, is the VO2, and over here is the VCO2, and you see that this is occurring over testing time. And so once you hit, which this should be 15 minutes, you can see that VO2 and VCO2 intersect at the point where VO2 max is achieved. While the human data does not look quite the same, you again see still a separation where at the top line you have the VO2, and at the level below you have the VCO2, and then they come together and peak by the end of the test at the point of VO2 max. Similarly, you can see, and this is an important thing to point out. So I talked about how these two lines are kind of coming together and meeting at the point of VO2 max, and then you can see the drop-off that's occurring. But as researchers, we often have numerous biological animals in an experiment. We average those data points and then create, our average summary. And I think it's important to understand that if you are using VO2 max data to kind of assess mouse cardiometabolic fitness and things like that, that when you average the data, you do lose some information. So if you look at this average test where it has this mouse's information as well as 6 or 7 others, you can see that we lose kind of that intersection at the VO2 max. And I think it's just important to note that out, because when you're trying to figure out what's the best way to display my data, I think it's important to display the single test if you're trying to kind of talk about the morphology of what's happening to these values every 15 seconds over the course of testing. But that the average tests maybe are best displayed in things where you're using kind of a bar graph, but not trying to depict kind of the kinetics of what's going on. Similarly, what happens when we look at that respiratory exchange ratio, which we talked about having an exponential increase in? So you can see here from human and mouse RER that although it's not quite the same, it almost looks even a bit cleaner when you look at our mouse data compared to human data. And so you can see that in a mouse test, you have kind of this slow, kind of very gradual changes in RER. And then at a certain point, you just get this nice, sharp peak exponential increase in respiratory exchange ratio. And because we have these nice values, we can actually determine things like anaerobic threshold, that point in which you cross over from aerobic to anaerobic metabolism. And that's a really great piece of information for us to have, because I think that you have to remember that in a mouse, we don't have anything around their mouth. We're measuring each and every breath. So anaerobic threshold is really our best measurement, because at this point in time, I'm not aware of any technology where you can specifically measure ventilatory threshold. Since we're not measuring at the level of the mouth, we're using an indirect telemetry chamber. And that's really great because anaerobic threshold can be used as a diagnostic. So we know anaerobic threshold occurs at a much lower percent VO2 max when you have some sort of impairment. And so you can essentially use these type of data for other things down the line, like detecting impairments in, anaerobic threshold in an animal per se. But you can also see that compared to the human data, it's a much harder, I guess in this human you could say, to actually find a peak increase, but you just see rather kind of this up and down of peaks and peaks across. But I will let you know that this can be changed, and so in some individuals, it looks much more like this mouse data. Unfortunately, we did not have access to a patient like that at this time when that was collected. Furthermore, what happens when you go ahead and average, you'll actually see that with the averaging effect, the single tests in the mice, when averaged together, start to look much more like the human data. So I think it's important to plot this out to make the point that if you're trying to calculate anaerobic threshold in an animal, it's best to calculate it off of each individual test and then summarize those data together rather than averaging your data ahead of time and then trying to determine that. Additionally, we talked about fuel substrate utilization and testing and determining a crossover point. Are we able to do that in mice and humans? Indeed, just as you can with human data, which is displayed on the right side, where we have the yellow line being fat oxidation, which decreases over testing time, and carbohydrate oxidation, which increases, and then you have a crossover point, which is occurring about, I would say, 65% of VO2 max, and then at the time in the test, it looks to be occurring, let's say that's 7 minutes on a test that's lasting 15. We see quite similar trend in the mouse testing too, where we get, again, this exponential increase in carbohydrate oxidation, a reduction in fat oxidation, and then if you're looking at the tail end of these lines, that's just kind of as the test is coming to end and the mouse is cooling down, but they should stay maxed out. When you average that test, again, I think this just really brings into an important point to highlight. You can see that the curves start to become somewhat different. So again, it's really truly best to calculate, let's say, a crossover point off of each individual test and then display it as kind of average. Otherwise, you, I think, lose some of that important key information about how the kinetics of each graph will look. So hopefully that answers all of your questions about what should my data look like if I'm trying to calculate some of these things, and what looks like when I calculate an individual test versus an average test. But I think it's also important to show not just what those things look like and how they look relative to human data, but also to understand how these data are impacted by disease. Because most people are not just working with healthy wild type mice running exercise tests. And so how are these data impacted by disease? And that's a question probably everyone wants to know, because we know in the clinic we can use exercise testing and see impairments in people who are obese or have heart disease, but what about with animals? And so just to introduce you really quick to our yellow/orange bar, these are wild type C57 mice that have diet-induced obesity, as well as over here in our red bar, we have a calsequestrin 2 knockout, which is a cardiovascular dysfunction model in mice. And so what you can see here is that with a graded maximal exercise test, that there's a significant reduction in run speed and run time with both models, which we would expect because they've got impairments and an inability to perform the test optimally. And then if you go ahead and look at their VO2 and VO2 max, you can see that indeed VO2 max is impaired in these animals, indicating that using a graded maximal exercise test, as we would expect, we can see kind of these clear reductions into extremely important values in terms of, actually ability to complete the test and then actual maximal oxygen consumption during the test. And so we see that, not just VO2 max is able to be picked up as impaired in these models of dysfunction, but also you can see that compared to the wild type trajectory when we're looking at plotting RAR, we have significantly different graphs occurring in both obese and calsequestrin mice. And, as expected with an animal that's undergoing diet-induced obesity, you see kind of this shift towards moving to a maximal RAR, and then the test just ends. Whereas you see with a model like a calsequestrin, which is arrhythmogenic, you can see kind of these huge spikes that are occurring. And with a wild type mouse, it's presumed we see this normal trajectory where we have this slow increase in RAR and then this nice exponential increase. Although I would also like to mention that these data are plotted from average animals despite the lack of error bars in this graph. And so these data, like I suggested in the earlier slides, are always best demonstrated for your own purposes, done for individual tests, and then calculating certain points if you're looking for things like anaerobic threshold. And so also we had talked about using respiratory exchange ratio to calculate fuel utilization. And so you can see that when we plot out the fuel utilization, where the solid lines are going to be indicating glucose use and the dotted lines are going to be indicating fat utilization, that we get this nice crossover point occurring, but occurring at different time points in wild type versus obese versus a model of cardiac dysfunction mice, as would be expected with clinical parameters. And then finally, not only can you kind of use these data to determine defects in known models that should have defects, but you can see that even if you has some sort of impairment, you're not sure what, if that impairment is related to an impairment in cardiometabolic fitness, you can see that even just by plotting those numbers in or having a reference, that indeed you're able to detect in a unknown knockout model defects in max speed or runtime or VO2 max. And so for people who are doing phenotyping, that can be really important for determining, does my animal have some sort of cardiometabolic defect? And so without that, I think we can get into some more questions and more, questions that might be helpful for your research.
Okay, so our first question today, is acclimation needed? And if yes, why? Chris, maybe you can start with this one and then we can ask Jen to share a little bit from her experience.
Yeah, typically acclimation for any experiment really involves taking the animals into the room for about 30 minutes or longer to acclimate to the new environment. But then, of course, putting them in a treadmill is a novel environment. Mice, of course, don't instinctively know what a treadmill is. It's a novel environment and the floor is moving. What do I do? So it takes them some time to explore, figure out what's going on, see what the shock grid's like, things like that. Jen might have some other input on the effect of acclimation and what happens if you don't acclimate, perhaps.
Yeah, we've definitely found that it's significantly important to include acclimation. I've heard many researchers who have access to metabolic treadmills talking about they have situations where the mice will run to the top of the treadmill and then just roll back into the shock grid. And I think a lot of times in a test that comes from not properly acclimating the mouse to understanding like what the actual shock will feel like, how to move their locomotion patterns, instinctively being on an incline and things continuously getting faster is not something mice, as Chris alluded to, have ever really experienced. So they really need that time to get that locomotion pattern done in that enclosed chamber with the nice encouragement of a shock grid behind them. So that way you can continue that test. Because if you do get into a situation where the mice are rolling back, it will have an effect on those graphs, how the RAR peaks, how the VO2 max peaks.
Our next question is actually one that came in from registration, and the person would like to hear a bit of a discussion between or a comparison between VO2 max and lactate thresholds, given that lactate threshold is more challenging to measure in animals. Jen, do you have any suggestions for this measurement to combine with VO2 max in rodents?
Yeah, so first off, to my knowledge, I don't think we can actually calculate lactate threshold during testing, and that's because in a human, when you calculate lactate threshold or you do a lactate test, as they're running on the treadmill, you're taking continuous finger pricks and then measuring with a lactate meter. Because of the way the indirect telemetry system works in the mice, they're in an enclosed chamber, and if we were to unseal it to perform a tail prick and collect lactate measures, we would lose our telemetry data. It would no longer be a secure circuit. So we can't calculate that information per se. We also can't calculate another surrogate measure of, because at the end of the day, lactate threshold is just telling you when you are somewhat shifting from aerobic to anaerobic metabolism. Another measurement of that is ventilatory threshold. And in humans, because with exercise testing, we're measuring gas exchange at the ventilation level every breath, because our measurement level is like literally coming from a face mask. And the mice is coming from that every 15-second sampling. So we can't per se calculate ventilatory threshold, but we can calculate anaerobic threshold by using and plotting out every 15-second interval RAR measurement in the mouse and then saying, okay, where do we shift from slowly increasing our point of anaerobic threshold. And so I think it's important. So instead of saying, what can we calculate from lactate threshold and VO2 max, I think we can say, okay, we can calculate anaerobic threshold in mice and we can calculate VO2 max, and they can both be values that can calculate it from the same test. They're both great pieces of information, although slightly different. VO2 max is going to tell you about maximum oxygen consumption, and that is increased in things like increasing muscle mass, increasing fitness levels. And then anaerobic threshold is a slightly different piece of information. It tells us, how long are we aerobic in a test before switching to anaerobic metabolism? And in conditions of dysfunction, that shift is occurring much sooner in animals. And so, by finding out that point, we can, deduce a whole separate set of parameters about the fitness and function of that animal. And so I think that those two values should and can be collected together and analyzed together. But it's important to remember they're different because let's say the purpose of your exercise testing in the mice was to, increase the aerobic fitness, let's say, of this mouse. Well, then you would be tracking over time, what point am I tested aerobic, what time in that test did I shift over from aerobic to anaerobic metabolism, and did that change later? And that's when you would use that AT value versus, am I globally increasing the fitness of mouse and looking at the VO2 max level, which we talked about. VO2 max is affected by many things, heart rate, stroke volume, and AVO2 difference. So I think it's important to, if we directly look at the question, I think it's important to note that at this time, measuring lactate threshold in animals in an indirect telemetry chamber is not a feasible measurement, although we can measure something similar like anaerobic threshold. We can measure VO2 max, and they're both information pieces that can be measured from the same test. I think they're important information pieces, slightly different, but still closely related. And so, I think they're definitely something that should be collected hand in hand, and it's definitely something that's doable relative to lactate threshold, which not so much.
Okay. Can VO2 max information be used to create a long-term training program for mice? And if so, what kinds?
Yeah, I think you can definitely use that information too. So if you're looking to increase the endurance of a mouse or the power output of a mouse, you can decide to train at different percentages of that VO2 max, or you could even use that anaerobic threshold information and train at different points at anaerobic threshold to elicit specific responses. And I think that's why information like anaerobic threshold and VO2 max and determining it from the first time you're testing these animals after acclimation is super important for people who are looking to perform long-term exercise protocols in mice, because just like people, every mouse is an individual responder. And so if you're really hoping to have a tightly controlled study, rather than just saying every mouse ran on the treadmill at 10 meters per minute and 5% incline for 4 weeks, and then this was the response, if you really want to keep your data as controlled as possible, you can be training these animals at a percentage of each's VO2 max, or calculating a specific workload based on the mouse's starting fitness. And then in terms of what type of programs, it really at that point is up to whatever your experiment wants to study. Do you want to increase the endurance of the mouse? Do you want to increase the power? And so by having VO2 max information and anaerobic threshold information, you really can just design appropriate programs. And because the test in mice is so similar to humans, you can really go off of ACSM recommendations for, training off of VO2 maxes or certain med equivalents.
That's great. And this is a good question. Why take measurements every 15 seconds or less during testing instead of every minute?
Really what we're trying to emulate here is breath by breath analysis. The human's wearing a mask, the mouse is not. And when you get that data density from a human, it's easy to make these calculations. But if you're getting breathing every minute and the test is only 12 minutes, you've only got 12 data points on your graph, and you really can't glean any meaningful information out of that. So making as many measurements as fast as possible is the key to getting good measurements on this test. The more data points you have, the more information you have. You can see your crossover points better. You know exactly when you're at your VO2 max. It's not a sort of a slushy curve or a bike ramp that kind of gradually reaches the max. You get a definite point. So the more data points you have, the easier it is to identify those key events.
Well, that makes a lot of sense. Can VO2 max be measured in a running wheel?
Maybe, probably not. Problem with the running wheels is voluntary. You'll find very few mice who will push themselves to the extent that you need to on a treadmill in order to actually achieve VO2 max. Compounding this problem is that a lot of running wheel systems that are in calorimeters are multiplex calorimeters. They're not continuous monitoring. So that as the single set of gas sensors goes through cage to cage to cage to cage, the mouse gets on and starts running. The chances that you're scanning that cage at the point that this mouse has hit VO2 max is very, very difficult to do. It's just random chance. It's not very repeatable. And while it might happen, it might be a curiosity, it's definitely no way to go about organizing a test because you've only got so much time.
Jen, we're going to go back to this one for you. I know you touched a little bit on it in your presentation, but can you maybe talk a little bit more specifically about how to modify these tests for animals with impairments, i.e. very old, obese, etc.?
I think it's important to know. So in the clinic, there are people who can't perform normal graded maximal exercise tests. They need some sort of modification, and in the clinic, they're able to modify maximal exercise testing protocols. I think it's important to know that the same can be achieved in an animal, let's say, where they're so large they can barely move in the treadmill, or they're so old that they're having some sort of locomotion issues. You can create less intense protocols for these animals that still have progressive increases in inclination and speed. And it's important to make a modification because you can't really acquire any information if your test isn't going at least 8 minutes. It becomes so short that you can't create those nice graphs where you're determining points of, clear, anaerobic threshold and clear VO2 max, because if the workload just increases so fast for these animals that they can't go, you're losing a lot of valuable data. So if that becomes an issue, we found that the best thing to first try to manipulate is to not allow the inclination to go over 5%. And so because the older systems, I think in the newer systems, you can have smaller inclination jumps, but I know for sure with the older systems, it was only 5-degree changes. So 5, 10, 15, 20, 25, not going above 5% inclination and just gradually increasing the speed seems to be a nice sweet spot for animals that really struggle with those large changes in inclination. On the counter, you can always also perform a test where you have, let's say, smaller jumps and speed changes and then still increasing the inclination. So I think it's just important to note that if you're not in that sweet spot of 8 to 12 minutes, you really lose valuable phenotyping information. And so if your mice fall into that category, modifying that is something that's totally doable. And if anyone needs access to the protocols, they're more than welcome to email me and I can send over the modified versions that have worked well for us.
Great. Let's see here. Can the system work along with telemetry? Chris, maybe you can tackle this one.
It can, and it sort of can. There's engineering obstacles to overcome, and then there's real life obstacles to overcome. Telemetry-wise, in the engineering department, what we have are the main obstacle you have is noise. The electrical noise from the motor can interfere with the radio signal from the transmitter. Additionally, we have a lot of static. This belt rolling on the rollers and over the platform that the animals run on creates a lot of static, which is another source of radio frequency noise. There are some things we can do to get around this. Typically, the static noise we get from the belt isn't too much to interfere with many of the readings from the more popular models of telemetry. The motor noise is something else that we can tackle by remote mounting the motor, moving it further away from the animal, or shielding it using a metal shield so that the electrical noise doesn't penetrate through to the animal. But in real life, the transmitter is an issue. They're surgically implanted. And the size of the transmitter and where it goes is of key importance, because some of the transmitters out there are very, very large. If they have batteries in them or something like that, they take up a lot of space. They're mostly implanted in the abdomen. And if you've noticed the animal running on the belt, they're dragging their abdomen along as they run. And if they've got a large transmitter in there and their belly's touching the belt, we're applying a belt sander to a surgical wound, which is not good. Also, the transmitter cannot be so large that it impedes the natural running motion of the animal, or they won't be able to hit VO2 max. So you won't be able to get the animal to perform the way you need them to perform. So it can be done, but it has to be thoughtfully done. You have to have a very small transmitter. And this sometimes means making some compromises on the data that you can collect, because the smaller transmitters don't collect as many parameters as the larger ones. So that's the compromise you have to make there.
Okay. And in the interest of time, we are going to make this last question, or this next question rather, our last one. So this person has said, I have a multi-animal calorimeter already. Can I measure VO2 max in multiple animals at once? Chris, do you want to start? And then Jen, maybe you can chime in with some experience.
Maybe, probably not. That's really two questions. Can you measure VO2 max in multiple animals? Yes, you can. Can we do it with what your current multiple animal calorimeter? Probably not. The overwhelming majority of multi-animal calorimeters are multiplex systems. And the problem with the multiplex systems and animals on treadmills is that they all start running at the same time. They all hit their crossover points at about the same time. They all hit their VO2 max at about the same time. But since the sensor is shared amongst the group of animals, it can only be measuring one of the subjects at any given instant. And then complicating this is every time it switches animals, it takes a significant amount of time to purge the previous animal's air from the sensor pathway, so that we know that the air that's in the oxygen and CO2 sensor is from this animal, not the previous animal. And that wastes a lot of precious time. This is a short test. We can't spend 75% of it purging samples. So the only way to really get VO2 max in multiple lanes is to do continuous measurements. Now, there are other people out there that have continuous measuring systems. And in those cases, if your existing system is continuous sampling, yes, you can do VO2 max in the system that you have. Otherwise, you might either have to upgrade or replace depending on the age of the system.
Jen, did you have anything to add?
I feel like that's actually just a really great job of, answering that question. At the end of the day, like you said, yes, you can measure VO2 and multiple at once. I think that to reduce operator error and human error, even though Columbus instrument devices I found have, especially the newer stuff, really helped, so that way you don't have many issues, because a lot of things have become automated. It's the most accurate when you're doing one at a time, because it's hard to get everybody stopping at the same exact time. So it's kind of exactly what Chris said.
Makes a lot of sense. Okay, well, thank you both so much for your insights today in your presentation and in this very engaging Q&A session. And of course, thank you to all of our attendees for taking time out of your day to join us for this webinar. And last but not least, a big thank you to Columbus Instruments for sponsoring us today. In closing, thank you again for taking part in this Inside Scientific webinar, and we look forward to having you with us again soon. Have a wonderful day, everyone.